Hey friends, this is Nurse Meg from nursemegRN.com, and I want to talk about nurse interviews today. I do have an interview blog post that I can reference for you. I'll put it down below in the description. In this blog post / article, it's going to tell you exactly what to wear. It's going to tell you how to write the perfect resume. It's also going to tell you what to say in an interview to like ace it, what they're possibly going to ask you. All that sort of stuff is really going to set you up. There is another video on this YouTube channel to kind of guide you through that. So definitely check that out. I'll link it also down below in the description. But let's talk about the other side, the person who's interviewing. So here are 5 things that the hospital won't tell you when you're being interviewed as a nurse. So number 1 is they are desperate, especially if it is 2022. Which it is now when this video comes out. They are desperate to fill the position because the alternative is that they have a travel nurse in that position and they are hemorrhaging money. So they are desperate to fill this position, okay? Most nurses that quit or, God forbid, get fired, there's not a lot of heads up. So they really need to fill this position ASAP and train you and get started. So number 1 is they are desperate. Number 2 is they will hire someone who is teachable, someone who is confident, and someone who is friendly over someone with experience with a bad attitude. Let's say 2 people apply to this position. One is a brand new grad nurse. The other one is someone who has 5 years of nursing experience. How are they going to differentiate these two? Some people think, oh, they're going to hire the person with experience. For sure. Not always. When I am hiring on our floor, I want to see so much more than that. I want to know that this person does not have a bad attitude. This person can work well with others. This person is teachable. This person is willing to learn. This person is friendly, and that they are confident. They can speak to doctors and speak to their coworkers and speak to family members with confidence. I will hire that person over experience every time because they can learn the ICU, they can learn the drips, they can learn the machines. But sometimes you cannot teach those other things. So that's something that they won't tell you that a lot of people get confused. You need to show that you are ready and willing to learn.
Oh, I'm being hired on the cardiac floor. I've never done an amiodarone drip. I would love to learn. I get along well with others. I'm great with conflict resolution. I love to listen to family members. I know that sometimes they just need to be listened to.
Woo! Say that. If you are having trouble with your voice as a new nurse, feeling confident, giving rapport, talking to family members, talking to doctors, and giving concise information, you should check out my course, How to Find Your Voice as a New Nurse. It teaches you how to communicate. It even gives you scripts on what to say. It will literally set you up. It's actually a mini course that I sell that is actually, you can buy that mini course or you can get like the big main course, the New Nurse Survival Guide. It's also included in that too, in case you are looking for a little bit of support as a brand new nurse. Next is that the hospitals won't tell you that they don't know what they're doing. We don't know what we're doing. When we're hiring brand new people and letting other people go and trying to hire, and we don't always know what we're doing, okay? And there's no secret formula that I can plug a name into an equation and be like,
they're gonna be awesome.
We're really just trying our best. So if we can hire more people, I'm gonna be begging as much as I can for the budget to hire as many people as I can over any other type of like, oh, we're gonna throw a party. The higher the staff, the lower the ratios, I know my floor is going to be safe. So I don't always know what I'm doing when I'm hiring someone. It's really based off of intuition and first impressions and the honesty of that person. So don't always think that, oh, these people are so much bigger and smarter than I am. Not always. We're just trying our best. Nobody has it figured out. Nobody, okay? Lastly, the hospital will always respect honesty over everything. So if you are interviewing for a job or you're getting hired and you already have like a vacation planned or something like that, come out with that forefront, okay? Be honest above all. If you've never worked with a certain machine or you've never used a certain drip, be honest, but always supplement it with,
no, I've never done that drip, but I would love to learn. I'm a quick learner. I would love to learn.
Be honest. Honesty honesty will always serve you more than not. If you have a vacation or family trip or anything planned, I want to know now when I'm hiring you so I can already plan ahead. And that's not going to be the make or break for me hiring you, okay? So I really value honesty over everything. So my best advice would be tell the truth, okay? So those are the 5 things that the hospital won't tell you when you're being hired on a floor. I hope this helps you. I hope this gives you a little bit of confidence and insight before your interviews. So good luck. I hope you get your dream job, and if you need any help at all, let me know. I'll see you in the next video. Bye.